A meniscus tear can cause pain and swelling and limited mobility in your knee joint, but luckily the right exercises can help to improve motion, decrease pain, and restore function in your knee. That's exactly what I wanted to share with you in this video today. I'm personally going to lead you through an entire exercise routine that you can follow along with right at home to eliminate pain and help you get back to doing those things that you love. But first, what is the meniscus and how can you be sure that that's causing your pain? Well, your knee is composed of two bones. You've got your tibia coming up from the bottom. You've got your femur coming down from the top. You have two discs of cartilage that sit right on top of the tibia. You've got one on the inside or the medial side and one on the outside or the lateral side. Those are respectively your medial and lateral meniscus. They add cushion to that joint and they also add stability to it as well. How do you injure your meniscus? It's most commonly injured in activities where you're weight bearing and twist. And so a slight bend in your knee and a slight twist in your knee will likely get that meniscus or cause that meniscus injury. Super common in sports like soccer and football and basketball, but I've also seen them in simple activities like turning around or bending over to pick something up off of the floor. Those can all cause a tear or a pinch in that meniscus. Typically, a meniscus injury will present as pain deep down in the joint. It's usually on the outside or the inside of the knee and down deep where you cannot touch it inside of the knee. It's usually made worse by weight-bearing activities, especially if you weight bear and twist slightly. That can really reproduce the symptoms of those pain. It's important that I mention right here that if you suspect you might have a knee injury, please go get that looked at by a local doctor or a local physical therapist. Most of these actually heal by themselves, but there are some that do require surgical intervention, and so your doctor will be able to point you in the right direction if that's your case. Also, I want to mention that these exercises that I'm about to run you through are not for a post-operative meniscus patient, meaning if you recently had surgery on your meniscus, these are not your exercises. The exercises you need to be doing should be given you by a physical therapist that are unique and personal to your plan of care. However, if you suspect you have a meniscus injury, if you'd like to try conservative care and avoid surgery, these are definitely the exercises that I recommend. I give these to patients and clients all the time. I know they're super successful, and I hope that you find that to be the case as well. That being said, let's get into this routine. The best place to do this routine is right down on your floor. You could do this on your bed, but you might find it a little too soft and not supportive enough for some of these exercises. You're only gonna need two pieces of equipment. The first is something to stretch with: a belt, a towel, a sheet, a rope, a dog leash, all work well. I've got this stretch out strap, it works great. And then the other thing is a foam roller. If you've got a foam roller at your house, great. If you don't, a big beach towel, a large beach towel rolled up works really well, or even just a pillow that you can double over. Now, if you're interested in any of these things, I do have them linked in the description down below, just FYI. We're gonna run through 7 exercises. We'll start with 2 stretches, and then I've got 5 great strengthening exercises that are going to help to stabilize your knee. I've got the timer. We're gonna do each one for about 60 seconds with about a 15-second break in between each one. So we will go ahead and get started. So the first thing I want to do is work on the extension in your knee, or basically how straight we can make it. An easy way to do that is with a hamstring stretch. So you're going to take your belt, towel, sheet, whatever you grabbed, put it around your foot, and then go ahead and lay down on your back. I'll push start on the timer and we'll get going. And so from this position, I want you to keep your legs straight and then pull towards you just as high as you can take your leg. What I want to do is get a good, comfortable stretch right through the back of your leg. You're probably going to feel that right here behind your knee and right up in your hamstring. You're going to hold that for about 20 seconds, and then you can back off of it a little bit, and then you can pull right back up into that stretch again and hold for 20 seconds. And we'll do that 3 times. Again, just a good, comfortable stretch to the back of your leg is all that we're after here. If you do have a meniscus tear, sometimes it is hard to straighten the leg all the way out. This is a good exercise to help you do that. Again, try to keep it in as comfortable a position as you can as you hold it for these 3 times 20 seconds. Should be just about there. 5 seconds left is all. Looks good. And then for our next stretch, we're gonna go ahead and get rid of the strap, and then we're gonna work on the bend in your knee. So the knee flexion stretch, the way I like to do that is lay on your back and then bend that knee up towards you as high as you can. As high as you can, pain-free. Now, if you can, what I want you to do is with your hands, grab right here around your shin and then pull that knee up and into your chest. Might be a little tender, but again, we're trying to keep it as pain-free as possible. That's what I'm trying to say. And so we're gonna hold that for about 20 seconds, just working on the bend in your knee. Hold for 20 and then relax. You can kind of come out of it. Some people will even kind of straighten it out for just a second, and then we're gonna get right back up into it again. And so a 20-second hold. With our stretches, they should be comfortable, but most importantly, I want you to breathe while you do these. Some people will kind of hold their breath because they're bracing for pain. Try to relax. Try to relax the rest of your body. No tension in your shoulders. Keep that nice and relaxed while you're pulling that knee up into your chest, just to work on that bend, just to keep the range of motion all the way full is what we're after with these first two exercises with our stretches. All right, the next exercise is going to be a quad set. So the quad is this muscle right here on the top of your leg. It's important that we maintain a good mind-muscle connection with that. What we're going to do is sit in a semi-reclined position right here. Now what I want you to do is fire those muscles on the top of your legs, fire your quads. We're gonna hold that for about 5 to 10 seconds, and then we're going to relax. And so a simple cue to remember is I tell people, try to push your knee down into the floor. If you try to push your knee down into the floor, you're engaging this muscle right here on the top of your leg, and then relax. Again, about a 5 to 10 second hold. So in this 60-second time period, you should get through, about 10 or so repetitions of this, about 10 to 12 reps, and then relax. Really good. The quad is one of the most important muscles as far as knee stabilization is concerned. And so we definitely want to keep that strong and functional, especially if your knee hurts and you're not using the leg as much as you should. This should be a very safe, neutral position for you to fire those quads and to maintain, again, that mind-muscle connection and strength right there in your knee. The next thing we're gonna do is take that quad set a step further. We're gonna do some straight leg raises. One of your quad muscles actually attaches above your hip. When we kick on hip flexion, it's another way to work that quad. So sit with your leg out straight. I like to bend my non-affected leg. We're gonna start with a quad set right here on the top so that leg's nice and straight, and then lift it up about 12 to 18 inches up off of your table. Hold 1, 2, and then slowly return back to that starting position. Nice strong contraction in the quad, lift and hold, and then return right back down. Some people kind of reset this every time. So if you get down here and if you need to relax that contraction, give it a little bit of a break, that's just fine. But make sure you hit that quad set or you contract that quad right before we go back up into that next contraction. So it looks just like that. And so we're working again, quads with hip flexors is a great way to keep that whole front part of your leg strong while you're trying to heal and recover from this injury. This is a great exercise. I give this to pretty much every knee patient that walks through the door just because it is so great. Okay, next let's grab our foam roll, or again, if you've got a large beach towel or a pillow, what I want you to do is tuck that right here under your knees. Just tuck it under the affected knee or the knee that we're working on. I've got a big foam roll, so I'm gonna put it under both of them. This is a short arc quad. With that knee in this semi-bent position, you're gonna contract the quad muscle right here on top, and then we're going to slowly lower it back down. So we contract until the leg is all the way straight. My leg's probably 8 to 10 inches up off of my table, and then slowly return back down to that starting position. Again, quad muscle with this as we're working on extending the leg. So that's one of the primary functions of the quad. What we're doing here is just we call it a short arc quad, meaning I'm working only the last 15 to 20 degrees of range of motion, meaning I'm not moving my leg through an entire range. I'm not going from all the way bent to all the way straight. But here in this terminal end range of motion, most people respond to this really well. It's a great way to introduce some gentle motion into your knee, which that joint thrives on, just that motion. That's what actually lubricates and helps the joint to heal. But we should be doing it, or what you should find, is that's in a very pain-free range. So that is what the short arc quads look like. Let's see, the next thing that we're going to do, we're gonna focus on the hamstrings, on the back of the knee now. Lay down with your knees bent. This is an isometric hamstring curl. What I want you to do is, the first thing is to dig your heels down into the floor. And so pull your heels, and you should engage those muscles right here in the back of your leg. You should feel those kick on. Engage those muscles, dig your heels into the ground, and then use your glutes to lift your hips up off of the floor. Hold 1, 2, and then return back down. Dig the heels in, feel the hamstrings kick on. Now engage the glutes up, hold 1, 2, and then right back down. And so we're after 2 muscles with this exercise. I want you to feel the hamstrings kick on. They're important in stabilizing the posterior aspect of your knee, or the back of your knee, and then also the glutes as well. And so those are the 2 muscles that you should feel this exercise in. Super important when we talk about knee stability. And so this is a great way that you can work those at home. Remember to dig the heels in. So dig the heels, feel the hamstrings kick on, and then up we go. Looks just like that. The last exercise that we've got on our list is going to be some hip abduction, or side-lying hip abduction. Great way to kick on the hip abductors, these guys right here. Great muscle as far as stabilizing the knee is concerned. I'm laying on my left side to work my right hip. Keep your right leg straight and pull your right heel up towards the ceiling. Hold 1, 2, and then slowly return back down to that starting position. Lift and hold, 1, 2, and then right back down. Try to keep your legs straight. I don't want your knee to be bent while you're doing these. And then try to keep your hips stacked, one right on top of the other. Meaning a lot of times people have a tendency to roll this to the back and let the hip flexors take over. Keep your hip pushed forward, so I'm pushing my right hip towards you. You should feel this kind of around the back towards the glutes. Kind of, you've got a bone right on the side of your hip. You should feel it right behind that and maybe up above it just a little bit. Again, these are your hip abductors. Super important when we talk about stabilizing the knee. This is a great one to work if you do have that meniscus tear going on. I've got great news. We've only got about 5 seconds left on this, and then we're done. Now, if you do have this, we just worked one side. If you do have this in your other knee as well, or if you have similar pains, these are all great exercises to take care of that as well. I hope you found this useful. If you haven't subscribed to Tone and Tighten yet, hit the circle right here to do that. For some reason, YouTube thinks you might like this video right here from Tone and Tighten, so check that out, see if YouTube's right. Again, I hope this helps, hope you feel better, and I hope to see you again soon right here on Tone and Tighten.